Hello friends, I am Dr. Yogesh Dravid, homeopathic physician, and I am practicing at Yeldu Road, Patil Galli, Vadgaon, Belgaum. Today I am going to present a case for your reference. This case is of a 82-year-old male. His presenting features are raised uric acid levels. His left limb was unusually swollen, that was causing difficulty for him to step forwards. Stiffness of the entire body, but more prominent part of the pain was felt in the left ankle joint. X-ray left foot AP showed that there was a presence of calcaneus spur, which was probably intensifying the pain during motion. He had dull aching sensation, worse at the beginning of motion and better after pressure. His complaints were always associated with loss of appetite and sleeplessness due to pain. His second concern was heavy distension of abdomen due to gas with constipation. Past history of pyelonephritis, which was surgically drained. Also, he had a past history of badly suffering with constipation. In 2007, he started unusual growth in his weight, for which every test was conducted, but the reports were considered normal. So later on, he visited an endocrinologist, and he was very eminent in diagnosing clinically with the overweight cases. After clinical examination, it was found that he had an inflamed pituitary gland, which was later on atrophied after some wrong medications, and hence there was hyposecretion from the pituitary gland. In turn, other all associated glands were also affected. Hence, his thyroid level was shooted out like anything and had to lifelong be on L-troxin tablet. At present, his weight is stable, but obesity is persistent. Meanwhile, in student life, till obesity was gained, he was every day going for early morning jogging and playing badminton at clubs. But ever since obesity has occurred, all his activities have stopped. Nothing uncommon was noticed in the initial part of the case. Hence, I had to enter into the mind. Doctor, I am 82-year-old man and I am running enterprise since 52 years. I have given lots of job opportunities to many people. Since I was a student, I have stopped taking dinner. I asked, why so? Patient said, when I was studying, I had to go to the mess via bicycle, just 3 kilometers to have only dinner. So what I thought, I hated eating bhakri, which was very commonly fed up at our mess. I had to go to mess, driving there for a long distance, and eating bhakri was not reluctant to me, so I stopped eating thereafter. Thereafter, I got habituated for staying hungry. His wife said he is very routinist at his profession. He cannot consume more food, intense craving for sweets, but due to obesity, he has stopped eating sweets. He has aversion to fruits and salads also. He is highly impatient and cannot wait anywhere. So restless that he can't even wait in your waiting room for a pretty long time if he is made to wait. If he has any commitment and if it is not fulfilled in time, he starts getting restless. His entire paternal family has history of death due to cardiac arrest. He lost his 2 elder brothers subsequently and had to take a huge responsibility of his enterprise, which was at the beginning phase of his life. I cannot tolerate injustice and anyone talking to me at high volume. Even I could notice that during my case taking, if his wife interfered during the talk, he just stopped her saying, "Me samto hai na, tu gappo bais." I could make out he is very domineering. He every day wakes up at 4 o'clock and does nothing, and later on sleeps at 7:30 till 10 a.m. The picture was very clear in front of me. Now it was the patient who was demanding the medicine, saying me, "Doctor, give me vomica." So I considered his following points as a totality for selection of nux vomica. Intolerance to warmth, 1 mark. More towards thirstlessness, 1 mark. No perspiration in spite of heavy workout. These points were subsequently made me to finalize the remedy nux vomica. After proper repertorial analysis, following points were considered for selection: mind saying anxiety driving from place to place, mind dictatorial, mind duty too much sense of duty, mind impatient, mind industrious mania for work, mind injustice cannot support, stomach thirstlessness, extremities inflammation of the feet, and general's warmth intolerance. Finally, nux vomica was given in 1 m potency as a single dose. His uric acid levels, which were 7.8 after 21 days, were notorically brought down to 6.2 after a single dose of nux vomica. Thank you.